right. Hi, good evening. It's so great you all took time for yourself to come to this Kaplan event. My name is Bridget, and you'll see me on the screen tonight, but in the background, we have a lot of help. We have two more RNs with us. One is named Jenny, and the other one is Jen. And both of them teach with Kaplan, and they know a lot. Sometimes they're on the screen, and sometimes I'm back there. But tonight, they're back there in chat to answer any questions that you have. So you can put in any questions to them that you might have. And I'll be the one on the screen, ready to give you information. Tonight, we have just an hour-long session together to go over how to pass the NCLEX in 75 questions. And that's not a lot of time for us to cover this topic, but we're going to do it, and we're going to cover as much as we can tonight in helping you to be successful on NCLEX. Because what we hear in our classes is this is what students want. One, they want to pass, of course. Two, they want to pass in 75. That's why the number one missed question on the NCLEX is number 76, because everyone wants to pass on number 75, right? They want the machine to stop giving them any more questions right at 75 so they can be done. But if you get to question 76, most students get a little rattled and think, why am I not doing well? Maybe I'm not doing well, right? But just because you get more than 75 doesn't mean you're doing poorly. So getting more questions is always a good thing. It means you're still in the game. So getting more questions is not necessarily a bad thing. But tonight we're going to focus on how to pass that NCLEX in 75 questions. First, we have to think about the NCLEX. We need to get into that right frame of mind. You've been in school, probably doing prereqs, getting ready for nursing school for 4 years, maybe more. You've been doing a lot of work to get to this point to be taking your NCLEX. So we have to think of the NCLEX as being happy that we're there, right? You're excited. It's not a roadblock to you becoming a nurse, is it? It's not a roadblock. It's an opportunity so that you can show your potential boss, you can show the National Council, you can get your license. It's an opportunity to show what you've done in nursing school. It's an opportunity to show everything that you have learned and that you're safe and ready to take care of patients. So this is a great positive thing in your nursing career, even though sometimes it doesn't feel like that, right? Think of the NCLEX like clinical. If I asked you now, what part do you like about nursing school? Almost everyone says, I like clinical. I like being with the patients. You like being in that atmosphere. You want to do things for the patient that are good and safe and right. And that's what you're going to do on NCLEX. You've shown your clinical instructors that you can provide safe, effective care to patients, and now you're just showing the National Council that you can do that. So it's kind of, think of it like clinical, where you're showing them that you can provide safe patient care. All right. So first we want to talk about understanding the NCLEX format, because this is unlike any test you've taken before. It's not like a test in school where you knew what content was going to be on it. Even if you took kind of a test in school that was a high stakes test, you knew what the content was going to be. If you were in pediatrics, you knew it was going to be about pediatrics. If you were in OB, you knew it was going to be about OB. But this one's a little different because they can give you questions on anything. First, this test is computer adaptive. So what does that mean? That means that the computer adapts to every person who's taking it. So if Jenny and I went to the same nursing school and we studied together the whole time in nursing school, and we went and took our test at exactly the same time, we could have two entirely different tests. And maybe Jenny would finish in 75 and I would finish in 205 because every single person gets a different test that adapts to you. The weird part about this, and you have to believe this, it's hard to believe, but every person who takes the NCLEX misses half of the questions. So pass or fail, you'll miss half of the questions when you take your NCLEX. And I'll be explaining how that is and how that's possible, because it's adapting to you. So we want to be getting questions that show that we're safe and effective, but even if we're getting those questions, we're going to miss half of them. Or if we get questions that show that we're not safe and effective, you're going to be missing half of them. So part of a good reason to understand this format is to understand that feeling of missing half of the tests on the questions. Half the questions on the test you're going to get wrong, right? So most people who finish the NCLEX feel like, oh, I didn't do well. And if it was a real test, you didn't do well because you missed half of the questions. So we need to get our students ready for that sort of feeling, right? Each question that you get is going to be challenging because it's based on you. So it's going to give you a question that's challenging for you, the individual. I teach pediatrics, so if I was taking the NCLEX, I would probably do pretty well on pediatric questions, but not so well on med-surg questions, right? So probably if I'm getting the NCLEX, I'm going to be struggling with those types of questions, and I'll show you what that means as we go through. But every question's challenging because it's based on our own individual abilities. For the NCLEX, this has been a really good thing because before we had the CAT, we used to take 2 days to take a test downtown on paper and pencil. We would spend 2 days taking that test. But that was a lot of times where students who do well, like high performing candidates, ended up doing questions that were easy, and they spent a lot of time doing that. So this CAT reduced the times that you're getting easy questions when you're a high ability, and it also reduces the difficult questions for those low ability candidates. So it's made the test more focused on the person to see, again, if they're safe and effective. All right. This is why you take the NCLEX. You're just showing them that as a new grad, you're safe and effective to take care of patients. They're not going to want you to perform at the level of an experienced nurse. They want you to be at that new grad minimum competency level. And it's all about nursing. It's not about medical. And that's really important to understand because probably your school, my program that I teach for, is based on a medical model. Because we have OB 1 semester, pediatrics 1 semester, mental health 1 semester, med-surg. That's more of a medical model. But the NCLEX is not based on a medical model. So you could get questions about any of those areas anytime because it's based on what nurses do, what nurses actually do. So for the NCLEX, you just have to show them you're safe and effective as a new grad, and that you have good critical thinking in nursing. So we're going to be talking about that too. All right. Okay, let's go to the first part of this is understanding the format. So again, it's not a nurse medical model, right? It's a nursing model. And so on this test, there's 3 ways to be done with the test. One is a 95% confidence interval. And with that, you're showing the NCLEX that you're safe and effective to take care of patients or that you're not, right? So they give you questions until they know that you're safe and effective or until they know that the candidate is not safe and effective. And that is a 95% confidence interval. Another way that the NCLEX can be done is if you reach the end, the maximum length. If you get to, for the RN exam, if you get to the 265 questions and you haven't shown that you're safe and effective, then that's one way that the exam can end. And another way is to run out of time. It's called the route. So if you run out of time, then you are showing that really what they do is if you run out of time, let's say that I finished my 6 hours and I ran out of time, but I haven't shown them that I'm safe and effective yet. What the NCLEX does is it looks at the last 60 questions that I answered. And if one of those questions is below the passing line, then I don't pass. All right, so we'll explain that a little bit more too. This is kind of a funny sentence because it is important to figure out the test before you take the exam. But what this statement means is during the NCLEX, we don't want you to try to figure out, is this question above the pass line or below the pass line? All right. We don't want you to spend time trying to figure out the exam. What we want you to do is understand the exam before you go in, and then just do your best on each and every question. But during the test, don't try to figure it out. Just answer the questions the best way you can and try to get past to answer each question, showing them that you're safe and effective. Okay, so let's talk about that nursing model. Let's get down to what is really on the NCLEX. And this is important to understand because it can make a difference in how you study for the NCLEX. So what's on the NCLEX? We get that question quite a bit. I think Jenny and Jen probably get that all the time. What's on the NCLEX? Well, this is what's on the NCLEX. Because all of us went to different nursing schools, different states, maybe different countries. So how does the National Council figure out that you know what you need to know to take care of patients? So they send surveys to new grads, and you may get one of these surveys, and they ask you, what is it you do every day? And this is what nurses do every day. So if I work in the emergency room, do I manage care? Yeah, I do that kind of a lot, right? Prioritizing patients, working with other people, deciding what's important, what's the first thing I should do, which patient should I see first? That's management of care, right? If you work in OB, you give pharmacology. If you work in the emergency room, you do that too. Physiological adaptation, do that in every nursing area. Pediatrics, you do that in mental health. You're doing some physiological. All of these things, basic care, reduction of risk, this is what nurses do every day. So no matter where you work, you do these things. Certain things are higher and lower than others, like right now, safety and infection control. So that's a lot of isolation, using PPE, super important, right? And we do that in every area. So that's really what's on the NCLEX. And it's important for you to know this because how you study for the NCLEX is figuring out which areas of these are you weak in. Because you may say, OB was my weakest area. I didn't like OB. But if I told you, you'd say, is there a lot of OB on NCLEX? Sure, because in every area on this could be OB, right? Safety and infection control. Can a patient on OB be in isolation? Sure, right? Health promotion. Do you promote health? Teaching about breastfeeding, teaching them about postpartum care, that sort of stuff? Sure. Pharmacology? Yes, we have that in OB. So OB, the medical, is mixed into what nurses do every day. So when you're looking to study for the NCLEX, you want to get a program that's divided based on how the NCLEX asks questions. Think about yourself right now. Which one of these would you say you're the weakest at? Just guessing. Let's just guess. I'll give you a second to look at them all. And you might not know what they all are, what they include, and that's okay too. Most students zero right in on pharmacology. They think, oh, I'm terrible at pharmacology. And students that graduate from my program say, oh, I need to know more pharm. I don't know enough pharm. There's no end to the amount of pharm you can learn, right? But usually our students in Kaplan do well on pharmacology. And you know what area they struggle with? Basic care and comfort. And my students struggle with management of care because I'm from California and we don't have teams. So we don't delegate a lot. We do a lot of primary nursing in California. So we haven't worked with LVNs that much. We haven't worked with unlicensed people, right? Yeah, there you go. Jenny's telling me that you all said physiology and pharm. Yeah. Yeah. And those are the two areas that are really intense, right? They're really intense and lots of testing on those areas. Yeah, good job. But our students on Kaplan really struggle with basic care and management of care. And so some students are really good at management of care because in their area, they got to do a lot of delegation and that, but, and they'll do surprisingly well on farm. So it's good for you to know that, because if you spent all of your time studying farm, but actually you're doing really well in farm, you could see how that may take away from times that you study. So no matter what program you use to help you study or what book you use, hopefully you'll use Kaplan, right? But if not, you want to pick a program that divides it up based on what the NCLEX is testing. All right, so we want you to start strong. So you're thinking about how the test works. So how does it work? You want to start off strong. Let's see what this slide gives us, the information. I am going to use a pointer here. So here's where you start off strong. So this is the level of difficulty right here of the question, right? And that is time on the bottom. Excuse me, I want to go back. It's not letting me use the pointer without changing. And here's time on this side. So when you start the test, before you even take your first question, we want you to think, I have studied hard for this test. I did well in nursing school. I provided safe care for my patient. I am ready to go. I'm feeling good. So the day before your test, we like you not to study at all. We don't want you to study. We don't want you to think about studying. What we want you to do is take it easy and relax, sleep, exercise, eat well, be nice to yourself, because we want that first moment of in the testing room for you to feel good and be ready, because we want you to get all of the first question correct. So how do you do that? And that's really why you came, right? You look at each question on the NCLEX like you're taking care of a patient. So you open up the door of the patient room with the first question and you look inside and you say, okay, what's the problem here? And then you look at the answer options and say, what's the safest thing, most effective, safest thing I can do? And you do that thing and you close the door and go to the next question. So when you go one by one, each one, you're going one by one to be safe and effective for patients. All right. So we're going to talk more about that. But when you're studying, we want you to do that too. Each question on its own, nice and clear. So make a nice study plan. Because in the morning when you start, or afternoon, whatever time you decide to schedule your NCLEX, we want you to be prepared. And we want you to have that confidence of, I studied every day. I worked hard in nursing school. I took care of patients, and have that confidence. Studying will help you find your weaknesses. It will help you figure out what you need to work on. So look at your own calendar and decide, when can I study, and put a block in there. If you're not a calendar person, which I know about half the people are to-do list people and half the people are calendar people, I'm a little bit of both, and you might be too. Write down how many questions you want to do every day if you're a to-do list person, and make it significant. Between 75 and 150 questions every day. So having a goal for each study session, super important. Doing questions and then reviewing questions, right? Study a little bit, study in small amounts and more frequently. Taking breaks in between, super helpful. Some people like to study in the same location all the time. And lots of research says that that worked. But there is some new research saying if you change locations, it gives you a fresh look at things. So think about what works for you. If you always go to the same place and study at the same time in the same way? Are you getting bored with that? Or are you having more effective when you, and maybe it's more effective for you to change locations? Set some goals for studying. At Kaplan, we tell you to study every single day, even if it's a little bit every day, because we want it in your mind that I should be doing this every day. But set realistic goals. Maybe there's a day a week that's not good for you to study. So make sure that the goals that you set works for you. Active or passive? Which one works for you? Now let's talk about what that means. So it's not just sitting in front of an open book, because if I gave you the Kaplan book to look at and told you to memorize 10 pages of the book, and in 2 weeks, I'm gonna come and have you write down all of those pages on a piece of paper, you probably couldn't do it, right? It'd be so hard to memorize what's in a book. It's not just having a book, it's not just reading, is it? And you know that because you've been in school for a while, right? Sometimes this is passive, right? Is writing down what is said or read. So if you just write down some notes and you're just, the instructor's talking to you, a lot of people like lecture, right? Because it's passive. Instructor tells you something, you write it down, you do the readings, you do what's expected of you, you just memorize for the test. But a lot, that doesn't stick. So in clinical, it's better, right? Is more active. In clinical, you're deciding what's important to write down. If I asked you to tell me what you learned in your very first lecture in nursing school, you probably couldn't do it. You'd maybe say, oh, that was that lecturer, Bridget. She was up there. She was talking about something. I can't remember what it was. It was something. But if I said, tell me about your very first day in clinical, in nursing school, I bet you could describe almost the whole thing. So thinking and being active and applying what you're learning helps you to remember things. You can do a little reading to help you think about what's the most important thing. Making outlines and study sheets gets you active and involved. Even making flashcards of that farm that you weren't too comfortable with. Making your own flashcards about farm is much better than me telling you what farm flashcards to buy, right? So doing your own active learning can make it better. Can you maybe tell Jenny and Jen some examples of some active learning that you've used in nursing school that has helped you to study? And then they'll tell me and I can share it with everyone. And that would be really great. Or maybe they can share it with them, because you doing study groups where you're teaching the material to other people, does that help you? That can be helpful, right? Even for people that are either whether they really know it well, it helps them if they're teaching other people, or if they don't know it so well and they're able to do that, to talk things through, it can really help them. So it helps both types of learners. All right. This is another thing to think about, something to think about when you get ready to study for your NCLEX. Are you a visual learner, auditory, or kinesthetic? Oh, great. I'm glad you can all see the chat. That's great. Jenny's saying you can all see the chat and that you're sharing about the whiteboards and diagrams. Great. Yeah, that's really helpful that you're showing. Visual and auditory and kinesthetic, those are ways of learning, the best ways that you learn. Auditory can be very passive, right? So people often from lecture, people only can retain about at the most 20%. It's very passive. From reading, overall, it's about 10%. It's very low what people retain from reading, right? So you got to get into this visual or auditory kinesthetic to help you practice what you learned about in lecture or during the readings. So writing flashcards can make a big difference. Using color coding, maybe for those pharmacology flashcards that you write, you'd use some coding for the different types of medications, maybe for respiratory, beta blockers, that sort of thing. You would use some sort of coding that makes sense to you. Auditory, studying groups, talking out loud can help. It can really help, and it can help you remember. And using things kinesthetic is more like in clinical. Skills lab, sim lab, people remember because they're able to build on concepts. After sim lab, after clinical, aren't you talking about what happened to you and what you learned during clinical conference? You do that too, talking about what you learned. That helps you to remember those concepts. Going for a walk or stretching can really just help you to remember concepts rather than just sitting there reading. It can help you reflect. It's like being in the clinical setting where you're reflecting on what you're learning and how you would prioritize. So think about what works better for you. Critical thinking is what this test is about. It's what your patient wants from you. They want a nurse who can think. They want a nice nurse, sure. They would rather have one who can think, right? To get the best decision made for your patient. Each question is written logically and methodically. Your approach must be the same. So what does that mean? That means when you answer a question, use a method that works for you. In Kaplan, we teach you the decision tree. The first step of the decision tree is most important. Well, they're all important, but I'll tell you the first step. The first step of the decision tree is to identify the topic of the question. This is when my students miss questions. This is usually why. They read the question and they thought they knew what it was asking, and they just went to the answers and started looking for the answer to the question they thought they were being asked, and they miss it. So it may say, find something wrong, and they will start looking for something right. And they'll say, oh, that's right, and pick the first one and go to the next question. Your first thing that you can do is every time you get a question, just read the question, not the answers, but read the question itself and ask yourself, what is this question asking me? Kind of like you do with patients. A patient asks you a question, you don't just answer them quickly. You say something like, okay, are you asking me this? You make sure you understand. If you can get that skill when you're taking test questions and use that strategy when you're working with patients, it will help you not to make errors. Almost every time a student misses a question, they say, I read that wrong. I knew that, I just didn't see that. I didn't think it was about that, right? They didn't identify the topic. Add that, identify the topic to your notes and use that on every single question. It will help you to get them right. There's two types of questions on the NCLEX. One is priority. So with priority questions, they give you one patient, one problem, and the best answer, right? So they give you a patient with a problem, and you have to determine the best answer. Next, you determine the topic. What is this question asking? Now, there's two types of question, priority and evaluation. For both of them, you need to determine the topic. What is this question asking? So this question may be asking, what's the best thing to do, right? What's the first thing the person would do? So look at the answer choices. The topic is priority. What's the first thing I would do? Then look at the answer choices. Is there any airway, breathing, or circulation answers? You gotta look at those airway answers first. Physical versus psychosocial. Is the patient are any of these answers fixing their physical problems, or are they psychosocial? Physical needs are more important than psychosocial needs. If the patient is bleeding, I don't want to make them feel better by telling them, oh, it's okay, you're going to be fine. That's psychosocial, right? I want to do something to stop the bleeding. Physical is more important than psychosocial. That's Maslow's hierarchy of needs. Patient always comes first. What's the most important thing? Putting the patient first. And then we always determine the safest, most effective nursing answer. This screen, if you haven't taken a picture of this screen, this would be a good picture to take and start using this methodical method on every question that you get. On evaluation questions, you're determining if something is good or bad to do, what would be good to do, right? This is a strategy you can use on select all that apply. When you're looking for risk factors, that could be a select all but apply question. Is it true that age is a risk factor for hypertension? You have the topic, you're determining if it's good or bad, and then you go down, right? So evaluation questions, you still determine the topic, but you're determining if they're good or bad. There are delegation type questions. There's rules for delegation and how to delegate and who to delegate to. Therapeutic communication is another strategy or type of question type on the NCLEX, where what's the best thing you would say to this patient? What's something good to say in response to this patient? What would you say, right? That's an evaluation. You're evaluating the statements. Select all that apply. All right, hopefully you have taken a picture of this slide because that one's very important. So let's give you, I think we're gonna, I think Jenny and Jen are gonna put up a question for you. So let's look at this. This is a priority question, right? A priority question. Which IV is considered a first-line treatment for a client diagnosed with hypovolemia? All right, first, the topic, right? The topic, hypovolemia, right? The IV fluid for hypovolemia. Do you see how when I come up with the topic, I'm using the words that are in the question. So in the question, it says, what's the first treatment for a client with hypovolemia? So we're going to be evaluating these. We're going to be looking at all of these and saying, would that be good or bad, right? Would that be good or bad, right? All right, hopefully you have your thing up there. Remember what hypovolemia is? It's when there's a significant loss of fluid and body and electrolytes. Good. This is an important question, right? This is an important question. So there's another layer to this, like what is an isotonic fluid? But right now you're wondering what's the best, right? What is a hypotonic crystalloid? But right now, all that it's asking is what's this? And yeah, it looks like you're getting this one right. So your answer here is 1, right? It is 1. Let me see if that highlights up for you. Oop, did it? Oh, sorry, team. Did not highlight it for me. Sorry, I thought I would show you that. Good. Yeah, your answer there is 1. Great. Eliminating. Good. And a good example of that would be normal saline, an isotonic solution. So your answer here is 1. Looks like Jen Allen said everybody got that one right. Good job. All right, let's do a priority question again. Another one. Client is being treated for shock after a motor vehicle accident with 10% dextran. The nurse will expect which outcome as a result of the infusion? So we're giving a patient that's in shock some fluid, right? What is the outcome of this? What is something good that would happen after getting this fluid? What is something good that would happen? All right. Number 1, so with this one, the topic is something good that you're expecting to happen, right? After you give a fluid. Now, you may not know about 10% dextran. So if you don't, put that down on your notes and write that down. It is a colloidal solution, but I want you to look it up if you don't know. But if you're taking the NCLEX and you don't know, then what do you think would be good? What is something good to happen for a patient in shock? What would be something good? Looks like you're doing well on this one too. Well, 3 is out because that fluid doesn't improve blood oxygenation, does it? It doesn't improve the oxygenation. That would be blood products maybe would help with that. Something good to happen. Decrease blood pressure, that's not good, right? We want the blood pressure to go up and increase. So we're going to eliminate 2 also. Now you're down to increase interstitial fluid or increase urine output. What would be good for a patient in shock? Increase urine output, right? Increase urine output. We were looking for an increased blood pressure and a decreased heart rate. That would show us that their shock is getting better. But also the increased urine output is showing that, right? It's a little more complicated, right? This is a much more difficult question, right? Much more difficult question. Let's do another one. Good. Okay. Looks like most people got 1. Well, most people got this right, but 3 is tempting, right? Because you're thinking that fluid's going to get it around more, but it doesn't increase the oxygenation, right? Does it make sense? I hope so. Hopefully Jenny and Jen can help you with that if you got lost on 3. Best answer here would be good if the patient had increased urine output. All right, let's do another one. Here's an evaluation type question. Ooh, this one, select all that apply. At the change of shift, the client reports swelling, burning, and tightness at the IV site. The nurse finds the skin is cool and blanching. Which actions would the nurse take? So let's identify the topic. Type in there, what's just the topic? Don't tell her the answers, but tell them what's the topic of this question. All right. So something's definitely wrong, right? Something's definitely wrong with the IV. Swelling, burning, tightness at the IV site. Something's wrong. Skin is cool and blanching. That's not good, right? Something's wrong here. What should the nurse do? Now, let me show you a couple more. Select all that apply. So we're looking for something good to do. So we want to go through each question and say, would that be good? Let's look at number 1. Great. Oh yeah, you're saying infiltration. Perfect. Check the client's pulse and cap refill time distal to the site. Would it be good to look at their circulation? And the answer to that is yes. So the first one that's right is, oh, it will not let me write on the screen. Sorry about that. The first one that's correct is number 1. That would be good to do that. Would it be good to continue the infusion until we get a new access, a new site? No, that would not be good. 2 is out. 2 is out. That could be damaging to the patient. It could hurt the patient, right? Better. So right now we just have 1. We're going to eliminate 2. Number 3, put the limb in a dependent position to increase blood flow. Ooh, this one's tricky, right? Dependent means down. Dependent means down. And they even add this to increase blood flow. Aren't they just bad? And for good to stop the infusion and Hey there. I hope. Am I back on? Does it seem like it's going okay? I don't know. Okay, I'm going to keep going. Sorry about this. I'm not sure what happened there. Hopefully you all can still hear me. Oh, good. Okay. I'm not sure what happened there. That's so funny. Okay, so we were just on this one. Great. Okay, all good. Thank you so much. Not sure what happened. I think I was using that. Anyway, it's all good. Okay, so good. Okay, so we're good with this one. Oh, I stopped at 3. So see how number 3, they're trying to trick you, aren't they? Because dependent position, you might be like wondering, I want to increase blood flow. Yeah, but dependent position is not a good way to do that, okay? So the answer here, again, is 1, 4, and 5, okay? 1, 4, and 5. Great. All right, let's keep going. So doing questions isn't really enough. I know, that's what we used to tell you. Do a lot of questions, do a lot of questions. You need to review the questions too. You need to look back and say, all right, so am I better now? So strange. Thank you. Thanks for being so patient. So you want to review each question because you want to review the content you don't know, and you want to review, why did I do that? Did I not identify the topic? Did I not do the ABCs? Was I not using my methodical approach? After I was done answering, did I go back and say, is everything okay? So you want to keep reviewing. You want to keep practicing and reviewing. And then reflect, what could I have done better? What should I have done differently? Do I need to review? Should I do more questions about farm? Should I do more questions about management of care to keep myself up? And then spending time studying. When you first start, you're going to get questions wrong, right? This is usually what happens. We have a lot of questions in Kaplan that are above the pass line, and students start and they don't get questions correct. They miss a lot of questions and they get down about that. I'm not doing good. I'm not doing good. But once you practice, reflect, get your system down, study the things you're weak in, you will see that you will start getting questions right. And then you will be more prepared for NCLEX. If you struggle at first, that's okay. It takes about 500 questions to be ready, just even to get your system down. Then you need to do some more questions to make sure that it's right for you, that it works for you. Good. So what they mean by here, the credited answer, the one that is correct. Credited answers, that means the correct answer, the ones that you get credit for, will be safe and effective for your patient. That's what that means. That the answers that are correct, that you get the points for, that get marked, that help you to get to passing, will be answers that are safe and effective for the client. So what do you do first? Those will be more safety for the patient. What's the priority nursing action? If it's a question about giving IV fluid and one of the answers says, maybe listen to their lungs, think about that. That's airway. Is it good to listen to patient's lung? Would that be helpful? Is that a good thing to do? It's airway. It's methodical. It does make sense if we're giving them fluid. Is that the priority? Which statements indicate an understanding? These are questions that does the patient understand the teaching? Those can be very difficult. The nurse is doing teaching. Which one indicates an understanding? For those, those are safety answers too, because they're going to be going home or taking medicine or doing a procedure on their own. Do they understand? That's really important. What concerns you the most? Always thinking about what's the problem here. Which one should I see first, right? What's my most concerning patient here? Which statement requires an intervention? So you're looking maybe for something wrong, right? Those are the ones that the student nurse is doing this. What could be wrong where the nurse might need to intervene? Look for answers that are the most or least safe. So you're looking for safety. If you get between the last two and you say, I'm stuck between those two, what's the most important? You want to pick the one that is the safest, the one that is the safest. Okay, this is always the hard part. Don't draw from personal experience. Now that can be hard if you have experience being an LVN and you're taking the RN board, or being an EMT and you're taking the NCLEX. You got to not use your personal experience, because remember, this is not about an expert in the field. This is not about someone with a lot of experience. This is about a new grad safety. So it's what they want you to answer is the way the book would answer. So if your preceptor did it this way, that doesn't mean it's right on the NCLEX. What's right on the NCLEX is the way the textbook would do it, Your past experience can interfere with your thinking. So you might have had a patient that they did this, and then you get that on the NCLEX, and it may have that answer on it. And that may have been the safest thing to do in the situation you were in, but one of the answers may be different, and it could be more correct in terms of what the textbook would do. It has to be what the textbook would do. So sometimes that previous experience can interfere with your thinking. So don't just base everything on what you've seen before. For stress management, we like you to be a little anxious. That makes you a better test taker. So a little bit of anxiety is good. It helps you focus and stay motivated. So knowing that this test is coming up, you're feeling nervous, all of that is really helps you to do a little bit better. Too much anxiety, though, can overwhelm you during your test experience. It can stop you from even being able to answer the questions. So example, somebody gets to question number 76. Somebody gets to question 96. Somebody gets to question 136 and they think, why isn't it turning off? Why isn't it turning off, right? Anxiety is getting them, and they just start guessing on all the rest of the questions because they just want the questions to stop. They don't want to do anymore, and that can end their test experience, and they don't do well. Anxiety took over. In your mind, think, I'm going to be there for 6 hours, and I'm going to have 265 questions. I'm going to be there for 6 hours, and I'm going to have 265. So tell everyone in your family, all of your friends, bring enough food that you're going to be there all day and you're going to be there for 265. If it's less, that's great. And it won't be more. Okay, it won't be more. Plan your day before the test. How can you control your anxiety? How can you help yourself to take a break? Can you just sit for 1 minute with your eyes closed and make your anxiety go? Or take 5 or 6 deep breaths to help your anxiety get under control, to keep you going to the next question. If every time you get anxious, you stand up and go get a drink of water, your clock still keeps going. Your clock keeps going, and you will use up your time. So we don't want you to get up and get some water or get up and go for a walk every time you feel stressed. We want you to manage your anxiety without having to do that. Okay, on test day, be prepared. Take that time to study before the test. Have something to eat. Sleep well the night before. If that means you need to stay in a hotel room the night before, do that. Tell them that your NCLEX instructor told you you should stay at a hotel the night before. If that helps you sleep better, maybe you should do that. Get there early. Don't be late. Bring a valid ID. You may want to drive by there a week before just to see where you're going to park, where you're going to leave your car, what you're going to do. You have to bring it'll explain this to you about bringing your picture, signature, and palm scan. So they'll do all that for you before when you go in there, and check your belongings. They'll give you a locker for that. My best advice is not to bring your cell phone in there. When you go in with your cell phone, they'll have you put it in a plastic bag and seal it. And when you're done with your test, you have to show it to the test person and they unseal it for you. If you forget to do that and you walk out with it sealed, you will not pass the test. So be careful with that cell phone. You may want to keep it in your car, locked in your glove box, or maybe not bring it at all, just so you don't get stressed, leave and walk out with your phone still in that bag. Think about during the exam. They give you an erasable whiteboard. When you fill it up, you can't erase it. You hand it to the person and they bring you a new one. So it's kind of, I've heard it's, people didn't think, I talked to one student who told me it was not just like a regular whiteboard, but something you write on and you can't erase it with your hand. They have to use a chemical to erase it. So it's not like you're going to be able to erase it usually, but they'll give you a whiteboard to write on. They won't give you a paper and pencil. When you're studying, use a piece of whiteboard, or you can use a piece of paper. And when that paper's full, just get a new one, okay? So just write it on a note. Treat every test that you do with Kaplan or whatever program you're using like it's test day. So you want to be doing well, treating every test like it's test day. Yep. You raise your hand and they bring you a clean board. You cannot use, this is one thing that a lot of students don't know. You can't use the board to cover up the screen. So if I just wanted to look at the question and just look at part of it, I can't use my whiteboard to do that. I can't do what I just showed you. I can't do that during the test. Good. And the whiteboard cannot be removed from the testing room except by the proctor. And you should take breaks. It will prompt you and say, do you want to take one? And when it does that, it's a good idea to take a little one. People do better if they take a little bit of a break before. Always trying to be positive. You did a lot to get to where you are. If you're having negative thoughts or there's some negative people in your life, this might not be the time to hang out with them. You want to be thinking positively. I can do it. I have studied. I'm going to study every day. I'm going to do being positive and positive actions, right? So doing what makes you feel good. A lot of students will tell me after they took the NCLEX, they'll say, you should tell your students to get a massage the day before or go for a walk or do something very relaxing so that you're not stressing about the NCLEX, that you're just relaxing and being positive and being nice to yourself. That is the most important thing that you can do. All right, I think that is my last slide. I know that Jenny and Jen have gotten some questions and have been answering them for you. And I think Nick is still here, so we say thank you to him too for helping us tonight. You have a few minutes to ask some questions if you want to. And I'll be here for a few minutes until Nick tells me that I need to go off. But I want to say thank you to all of you for coming tonight. We're really happy that you were able to spend time with us. And we hope you enjoyed this event. And maybe you have some suggestions for more things that we can do in Kaplan to try to help each of you to pass the exam, because that's really what we like. That's why Jenny and Jen and I, we have other jobs and we teach in nursing, but we love doing Kaplan because we love to see all of you passing thing. We like anybody, to take that test and pass is just like such a great thing. So we really want you to feel comfortable with that. All right. Well, I'll say good night to you because Nick is saying it's our time. So thank you so much and have a good night tonight. And hopefully we'll see you soon in Kaplan. Thank you. Bye.